Hello and welcome. In today's episode of Dr. Nora, I take on a daddy makeover using anti-wrinkle injections with the aid of a vein finding system to reduce those appearances of bruises. So today we're going to be doing a daddy makeover and we're going to be focusing on the upper face anti-wrinkle injections. Now, one of the complications that can happen when you are having anti-wrinkle injections is that you may develop bruising. And commonly this can happen if your practitioner isn't able to see where your veins are located on your face. Some people are really blessed and they have really big bulging veins that are visible on their face, and some others may not necessarily have that. And so with the aid of this vein finder, I'm going to see if I can locate those veins so that I can avoid injecting into them, helping to reduce the incidence of those bruises occurring. Okay, it's time to get our model in and draw on his face. Mr. Model, thanks for joining us today. It's great to have you. Now, you have had anti-wrinkle injections before in the past, but as with any patient, we have to go through our medical history, make sure that there are no contraindications to having anti-wrinkle injections, and of course, going through our consent procedure. Now, I have a special device I'm going to be using today. It's a vein finder, and the aim of it is hopefully to reduce the incidence of any bruising that can occur when we have these procedures done. So I'm just going to shine the light around the forehead now and just see whereabouts the veins are located. And as you can see, there are some quite big veins on the side and right in the middle there. So this is going to be super useful when I'm drawing on my dots on the patient's face so that I can avoid those big veins so we can avoid the incidence of bruising. So today I'll be using an application called Treatment Pad, which allows me to easily take accurate before and after photos for the procedure. Okay, Mr. Model, I want you just to stand there nice and still for me. So we're going to do a natural face. That's it. And the application does have an inbuilt camera angle system that helps keep my photos nice and consistent. Excellent. And give us your angriest face. Perfect. All right, Mr. Model, it's time to get injecting. So first up, we need to clean the areas that we're going to be injecting. And for this, I'll be using some alcohol wipes. And then I'll be drawing some dots on your face over the areas that we wish to get injected. And we're going to go ahead and do the frontalis muscle first, or the forehead muscles. So raise your eyebrows up as high as you can go for me. So the idea of drawing the dots is to make sure that one, we're in the correct location, which is the frontalis muscle. And secondly, that we're getting a nice even distribution of our anti-wrinkle treatment over the whole of the forehead, because it's not very good if you treat half of the forehead and not the other half. So we want to make it look nice and symmetrical on both sides. Raise your eyebrows up again for me. Thank you. And give me a frown. So now let's use the vein finder to make sure that we're not hitting any veins. By the looks of it, it looks like we have managed to spare any veins. But of course, if you do have a landmark that is over the course of vein, then obviously you can move that along and you're not injecting the vein. Right, so now that we know that our landmark points are clear of any veins, this will hopefully help to reduce the incidence of any bruising during our injections. Okay, so I want you to now go into a nice zen zone, relaxing for me as much as you can, and just a few short, sharp scratches coming up.
You're squidgy man.
Would you like Squeezy Man? I can get him for you. Of course, patient comfort is paramount. This is Mr. Squeezy Man for you. Closing your eyes, going to a nice zen zone now. Well done. Now we're injecting into the glabella. And then going into the corrugator muscles, the head and then the tail. You'll be pleased to know that your torture is almost over. So as a routine, I generally always treat my patients for spot lines, because what I've noticed over time is that when you take away the frontalis muscle and you take away the frown muscle, you often end up with these kind of spot lines. So I just pop a little bit of anti-wrinkle treatment in the upper brows just to counteract the effect of any spotting that can occur. Okay, so we're going to go ahead and we're going to do your crow's feet now. So again, looking towards me. Thank you. That's it. Your torture is complete. So now it's time to clean up the areas. And you will notice that the model has got some little bumps there, which is very normal for anti-wrinkle injections because we are injecting a fluid into the area. And these raised little bumps will take about 15-20 minutes for them to settle down. But the good news is I can't see any major bruising that has occurred. And sometimes that does happen fairly quickly when you have injected into a vein. You often see that it bleeds a copious amount of blood and you might end up with a little bit of a swelling, a little bit more than what we're seeing at the moment. Of course, it's really important to go through your aftercare injections.
Thank you.
Yes. But in saying that, bruises do occur, and if it does happen, they will usually settle down after 3 to 5 days. So it's not the end of the world if that does happen. Now, of course, we have to go through our aftercare instructions for the patient. So making sure that you keep your head upright for the next 4 hours. No rubbing or touching of the areas, no makeup or lotions over the injected areas for today. Yep. And then, of course, everything back to normal again tomorrow. And you will start seeing some changes in the next 3 to 5 days with optimal results in 2 weeks. How are you feeling? Love the squeegee, man. Okay, I'm just going to make sure that we don't have any white spots on your face before I let you go home. And if you are having anti-wrinkle injections, then as I said, these little red marks will go down in about 20 minutes. I often say just keep nice and cool and it will settle. And if you are washing your face the day of the injections, just wash it with some water. Don't need to vigorously scrub anything, and avoid any facial massages or anything quite invasive to the skin for up to 1 week after injections. As we saw in our procedure, we had minimal bruising, and this was thanks to the landmarks being drawn away from the veins. Now, this was confirmed with our vein locator, which helps us to work out that we were not injecting into the veins. And of course, we know that the main reason why patients may have bruising after these types of treatments is because injections have been made into the veins. So is this the future for safe cosmetic injectables? Let me know what you guys think in the comment section below, and I'll see you on the next one. Take care and stay healthy.